Welcome and thank you for participating in the first HUD HHS Regional Office training sponsored by CMS's capacity building work. This is the first federal training opportunity for the regions, which brings together the Dallas and Atlanta regional staff with Money Follows the Person grantees and their housing partners from these states. I want to begin by giving you some brief background on the HUD HHS collaboration. The collaboration is structured to advance three objectives. First, to meet the needs of vulnerable populations by better connecting housing, healthcare, and social services. To help us work together in a more coordinated fashion to achieve common goals, and to create a forum for ideas and input on how HHS and HUD can better serve populations that rely on housing and supportive services. To carry out this important work, we created three interdepartmental working groups. One to address issues around the needs of those Americans that are homeless. Another to focus on making our homes and communities more livable. And a third to look at our work on community living, helping seniors and people with disabilities lead meaningful lives in their communities, which is the focus of our meeting today. Our community living initiative began on the 10th anniversary of the U.S. Supreme Court's Olmstead decision in June of 2009, when President Obama announced the Year of Community Living. This announcement led to two specific efforts. First, it led to reinvigorated efforts by the Department of Justice to enforce the right of individuals with disabilities to live in the most integrated setting possible. Second, it led to a stronger partnership between HUD and HHS to coordinate accessible and affordable housing with long-term services and supports that certain people with disabilities need to live in the community. The interdepartmental work group established to oversee this work created several initiatives, which include the capacity building work that brings us together today. This training is the first in the series of 5 that will promote a better understanding of just how the various agencies of the two departments are working together towards our common goal, ensuring that people can get an accessible and affordable home in the community with the right mix of long-term services and supports to ensure that this living arrangement endures.
Hello, everyone. I want to echo Henry's thanks to each and every one of you for participating in this first HUD CMS Regional Office training. Your work is inspiring, and we wish we could be there to meet each of you and learn more about what you do on the forefront, as I like to call it. While our individual agencies have worked for decades to better serve the elderly and people with disabilities, in the Obama administration, we've worked harder to better coordinate our common efforts on housing and healthcare services. The HHS HUD Housing Capacity Building Initiative for Community Living is just one example of that new collaboration, and I'm proud to say there will be more to come. HUD serves many elderly and disabled low-income people. Over half of the 4.5 million households in HUD-subsidized housing include an elderly person or a person with a disability. And it is a HUD priority to not only provide them with safe, decent, affordable housing, but to ensure that they can live happy, productive lives. That's why Secretary Donovan and Secretary Sebelius have joined together to meet President Obama's call for collaboration. They want to make collaboration a common practice instead of a random act. Indeed, Secretary Donovan has included the ability to better coordinate HUD and Health and Human Services in the agency's strategic plan and has made it a priority part of our larger effort to use housing as a platform for improving quality of life. That's why HUD has revised the Section 8 program, resulting in more than 3,000 new units for persons with disabilities. It's why we provided approximately 1,000 vouchers for people with disabilities to transition out of institutions and have helped make HHS's Money Follows the Person demonstration grant a great success. It's why we're proud that innovative programs like HUD VASH, which combines HUD's Housing Choice Voucher rental assistance with VA's case management and clinical services, have been able to house more than 28,000 homeless veterans. And it's why we have a service coordinator program in public housing to assess the needs of the residents and coordinate available resources in the community to meet those needs. But despite our progress, we need to do more, and one of the ways we can do that is to better understand what each of our agencies do to serve the elderly and people with disabilities. Not just the programs and jargon, as important as they are, but our greatest resource, the people, your peers at each agency who do so much to improve the lives of elderly people and people with disabilities. This is a large part of what you will learn about in today's training, and I want to thank you for your hard work, your sacrifice, and your dedication to the families we serve.